Donna Kane Francis.
My name is Jean Davison.
I'm Dr. Michelle Taylor Skipper.
I see on average about 20-25 patients a day, and I'm there 3 days a week.
I have 5,000 or 6,000 individual patients in my little solo practice.
I am co-owner of Family Practice in Cary with my physician counterpart. Current regulations require that I have a supervising physician.
My collaborative physician sold his practice, and in the process they told him he would no longer be able to be our collaborative physician.
In one moment, my practice could stop.
If by chance, let's say my supervising physician decides that she wants to stop working tomorrow, I would have to close my practice as it is and develop a relationship with a new supervising physician.
I'm just worried about the day when I'm no longer able to bring these skills because somebody else outside of my profession decides whether I provide or not.
I can't hire myself out because I don't have a physician to make it legal. But I'm fully qualified.
This should not be a mandated issue for nurse practitioners to provide safe health care.
I don't really think that it adds anything relative to the safety factor.
Nurse practitioners in very many ways are more cautious.
There's not an issue of safety. I know what I know and am not afraid to say what I don't know.
If you want to look at safety, we're probably more conscious of that even than our physician counterparts.
I've never seen it before where one level of professional is required to have another professional dictate to them practice and then ask to be paid for it.
The current regulations have been a drastic block for me to volunteer my services.
I'm very restricted of what I can do as a volunteer unless I happen to have a supervising physician there with me doing the same sort of volunteer work.
I live in a rural county in one of North Carolina's poorest counties, and my clinical practice is in Scotland County and the highest unemployment rate in the state of North Carolina.
Access to care has been decreased in this Asheville area.
It's been interesting to practice in all the different regions of North Carolina, realizing how essential indigent care, and now that I'm east of 95, rural care is really needed.
So we need access for patients to be as simple as it possibly can.
I think it's really unfortunate for the consumers in North Carolina to have to jump through that hoop.
It is my hope and my desire that at some point North Carolina will be able to tell nurse practitioners and their patients who access them eagerly that we will no longer have to be able to say, well, I'm not sure if I'll be able to provide that, or I don't know how long I'll stay open.
The healthcare state in the east of 95 is really desperate for some of these changes to occur.
And eliminating a barrier to having a nurse practitioner be able to fully practice to their scope of practice in a rural area will expand care for everybody.